In Singapore, sometimes nursing is a very thankless job. When I first wanted to be a nurse, my mom objected it very strongly. She felt that it was a dirty job. With the urine and feces, nurses are actually assessing patient's state of illness. Patient has been given a life sentence with kidney failure, but I want them in the years that they're alive to be able to find hope and a purpose. Seeing them achieving their life's goal gives me the greatest satisfaction money cannot buy. In order for patients to live their life to the fullest, family is always the reason.
With an aging population and the increase in complex diseases, healthcare workers are in great demand. Although they make up for the largest professional group of healthcare workers, there is still a lack of nurses in Singapore. In today's Conversation for Impact, we welcome Pauline Tan, Assistant Director of Nursing Services of the National Kidney Foundation Singapore, to share with us her journey on being a nurse and healthcare leader in the last 36 years. Pauline is passionate about raising the standards of dialysis care in Singapore and empowers her nurses in taking an active role in patients' clinical outcomes. In this episode, Pauline shares with us the common misconceptions of being a nurse in Singapore, how she remained committed in her role for over 36 years, and how she overcame her challenges and led her team of nurses in making a difference on their patients' rehabilitation journey. Hi Pauline, thanks so much for taking the time to join us. Amidst the disruption caused by the COVID-19 pandemic, it has a silver lining. That is, there is a greater appreciation for nurses in Singapore and the healthcare worker as well. In your words, what is the role of a nurse in the healthcare sector?
There's a lot of misconception of what a nurse is. I first wanted to be a nurse. My mom said she objected it very strongly. She felt that it was a dirty job. And it is a demanding profession, physically, mentally, and emotionally. But being in a nursing profession for the last 36 years, I've not regretted. The role of a nurse is not just about bedside nursing. It is about caring for a human being who's struck with a disease and they're not able to help themselves. And in the midst of supporting their ADL, we are also need to be armed with that knowledge and to understand patient so that we'll be able to identify the gaps and why they are not able to embark on their own activity of daily living. And from there, that assessment, we will then come up with treatment plan to support our patients to be able to recover. Give you an example, sometimes my mom would say, a nurse will have to clear patients' urine and stuff
feces,
like that. But, with the urine and feces, nurses are actually assessing patients' state of illness.
Wow.
So if the urine has blood in it or it is tea-colored, it actually indicates a problem with the kidneys or with the gallbladder. So it is shown in all these excreted urine and feces. And if we see a very pale colored feces, then we say, something's wrong with there's not enough bile, there's a blockage, in the gallbladder. So nursing is not just, a bedside caring for somebody, but it is about an assessment. And that requires knowledge and integration of that knowledge into that practice to help somebody to recover and so that they can be well again.
Why did you choose nursing as a profession earlier on? Do you think it's a calling that you had initially, right from the get-go, from the start, or do you think it's something that you developed over the years?
Well, after I finished my A-levels, I realized that I don't want to go university and do a desk-bound job. And so I asked myself, what I would want to be. It's because of my faith, So I after my A-levels, I prayed. In the midst of reflection, I realized I'm a very caring person, especially I have a very close relationship with my grandma. And so I'm very caring towards the elderly. And so I said, I would either become a teacher or a nurse. And so with that thought, I decided that I wanted to try it out. So I tried it out working in nursing home for 3 months, and I said, oh, I really love this job. And I had a lot of role models, nurses that were trained in United Kingdom. And so they said, Pauline, go to UK, and apply for nursing school. So I applied. I got into Oxford Radcliffe in United Kingdom, but my mother refused to buy me the ticket.
Okay.
So
did you have to self-fund?
Well, I was only 19, right? And I wasn't working. So I had to let go that desire. But a couple of years later, I decided to do nursing in Singapore. So I applied to School of Nursing in 1986. And so I became a nurse despite their objection.
And why community renal nursing?
So I was in a acute public hospital for working in a surgical unit for about almost 5 years. And I had an opportunity to work in a surgical unit in Canada. But I realized that working in an acute hospital is a touch and go. Our patients come in for surgery, example for appendectomy and so on and so forth. And after that, we don't see them anymore. And so I was looking for that satisfaction of my work. I felt that that relationship was ad hoc.
A bit also transactional.
Correct. And so you get to know the patients for a couple of, maybe 1 or 2 weeks, and after that, you say goodbye. So I happened to, in 1994, join NKF because of the Sunday off and no night shift, because I had a very young baby. Initially, when I started working in the community renal nursing, it was really tough because I enjoyed that relationship with patients, but I found that they started to pass on because they're at the end of life. And so I started questioning, what is the meaning of community renal nursing? Am I dialyzing my patients to death? And what is my role as a renal nurse? I only found that answer in 1999, where I was very influenced by this nurse educator who talked about renal rehabilitation. Say yes, patient has been given a life sentence with kidney failure and they will die. I mean, all of us will die one day, but it's just that their life is being cut short. So with dialysis, they only have about 5 to 10 years of expectancy. And so what do we do with that 5 to 10 years? So that's where I started embarking and understanding what renal rehabilitation is all about. And it changed my perspective altogether, whereby I then realized that, yes, patients going to die, but I want them in the years that they're alive, I want them to be able to find hope and a purpose. And the whatever remnant years that they have with the treatment that's been given to them, they must be able to find that purpose, that hope, and they'll be able will to live and live it to the fullest with no regrets.
How has this realization helped impact your profession as a nurse and personally as a human being as well?
Yes, when I was working in the surgical unit, I didn't find that satisfaction. I'll give you an example. I had this patient who came to see me in 1999, first time on dialysis, and we made friends because we speak the same dialect. And then she said, Pauline, the doctors told me that I've only got 5 to 10 years to live. What am I going to do? I've got 3 young boys in primary school. I think the oldest was like in secondary 1. I don't want to die so early. I want to see my kids grow up and get married, I want to live a full life. So I told her, I said, it's a partnership of care. She has to do her part in complying with the treatment plan, because kidney failure patients on treatment, they don't die of kidney failure, but they die of cardiovascular disease or cardiac failure.
Oh, okay.
Because of the fluid overload, the low hemoglobin that can actually assault the heart, so the heart will fail eventually. And not only that, their immune system is compromised, so therefore they do die of an infection. So one of the focus that I have in communicating with this patient is that we want to reduce that risk of death. So in order to reduce that risk of death, then they would have to comply with a lot of the advice and the treatment plan that we have. Because it's tough, right? You've got to do 3 times a week of dialysis. You've got to restrict your fluid. You've got to restrict your diet, things that can affect your bones, that sort. So they have to comply. There are things that we cannot do for them. So it's a partnership of care, model that I always talked about to my nurses and to my patients. And so Madam Cheng listened, and through the years that I was nursing her, she did very well. She was involved, she was empowered, and she was involved in her own treatment. So she was able to perform the role of a mother and housewife and wife, very well. So I left to Canada in 2008. And when I came back in 2017, I went to this dialysis center and I heard somebody called my name.
Wow, okay.
Pauline, and then so I looked and I saw Madam Cheng, and she was so happy to see me. And she told me that her children are all grown up, got married, and she has 7 grandchildren.
Fantastic.
Yeah.
So she actually lived to see all of this because she took charge of her own healing.
Yes.
And with the help of and the support of the nursing staff throughout the entire period of their rehabilitation as well.
Yes.
That made it all. And would you say that this is the motivation of you going forward as a nurse as well?
Yes. I think I have applied this model of care, not just in Singapore, but also in Canada. And the ability to motivate someone to want to live their life to the fullest and knowing how to do that and seeing them achieving their life's goal gives me the greatest satisfaction money cannot buy, And it's the reason why I've stayed in renal nursing for the last 28 years.
And for the patients that have, come and eventually go because of the illnesses, how do you regulate that kind of emotions when it comes to passing of patients?
Just the way I grieve when my family members pass on. But one of the things that I told myself is to have no regrets. That I have done my very best for these patients and that I have motivated them to be able to live their life to the fullest. I just want to share another story.
Sure.
I have a patient who had liver disease as well, besides kidney failure, when I was nursing her overseas. And we helped her because she wanted to live. It was very difficult nursing her because she always had hypotension on dialysis, but she has great support from family. Finally, after supporting her for 5 years on long, slow dialysis, we have an in-center nocturnal. So she does 8 hours dialysis.
Wow.
So it's more gentle dialysis for her. And by the time she reached 5 years, she was going downhill. And one day we talked about the possibility of stopping dialysis because she was going through too much sufferings on dialysis. And then with that conversation with us, with the social worker, with the nephrologist, she then made a decision to stop. And there was a program when you stop dialysis, we actually put them in, because they can die in the next couple of days or weeks. So we'll put them in a room with a white rose outside the room.
Wow. Okay.
The family members will stay there with them to spend the last days with them. And so all of the nurses had that opportunity to go and say goodbye to her. So I thought it was a very dignified way to pass on when you decided that treatment is just not possible anymore. And I have lived my life to the fullest and I'm ready to go. And so all of us went up to hug her and she had this great smile on her face that she said, I said, are you sure? Are you sure you're just gonna go? She said, Pauline, I'm at peace.
Wow.
And so she died 5 days later. I mean, of course, all the family members are sad, but they also accepted that decision.
I find that other than providing healing and health care to patients, nurses also provide that kind of support for family as well.
Yes.
And in a sense, like what you said earlier, right? Other than ensuring that the longevity of the life continues, even at the end of it, you guys give a good closure for the family members involved and also the patients themselves. And it's very touching. What would you say for people who want to be in this profession?
One of the key to becoming a community renal nurse is the desire to want to be independent in your practice, to have that ability to nurse the patient holistically, not just the disease process, but nursing the patient emotionally, psychologically, and physically. And so renal nursing in a community require nurses to be self-directed because there's no doctors on board. And so the nurses need to be very knowledgeable. The doctors come, they're on a consult, they come and visit on a monthly basis, but the nurses are the one that will be providing that treatment. And so in order to be a nurse-led kind of community renal nurse, you need to have the knowledge, the resilience, and the passion to want to help another human being to want to live their life to the fullest. Especially, this is practically a end-of-life kind of treatment.
Yeah. It seems like there are also a lot of challenges that goes along with being a nurse as well.
Yes.
In your service with NKF, what is one of the biggest challenges you faced and how did you overcome them?
I went through 2 pandemics here.
Oh, that's one. That's one major challenge.
Yeah. And COVID has been the greatest challenge. Yeah. I think we have great nurses who have been in the profession are very resilient. And they step up the plate whenever there are issues and emergencies, you know. I think the greatest challenge is being able to, because you are helping somebody who is sick, right? And you are dealing with multiple persons, emotional, psychological, physical, as well as social problem. And so when you finish work and going home, you need to be able to compartmentalize. And so I think it's one of the challenges that nurses face. Initially, when I started, it was very hard because it's hard to grieve when these patients are your friends and they passed on, or they're having a hard time, or we can't get the needles in because their access is just so difficult. And so it is very hard on the nurses sometimes that we feel, hey, how come I'm not good enough, you know? How can I be good enough for my patients so that they don't have to suffer too much? And so I think this is one of the challenge. Some nurses, they are not able to compartmentalize and they are not able to handle that difficulty that they're going through. But once they're able to understand that they can only do that much and they're not alone in the work in the community. There are a lot of people that are supporting. That's why the teamwork is so strong. We also have the social worker, we have the dietitian and the allied health, the doctors in the team itself. And so we are not alone in handling all these problems. So I think when the nurses understand that it is an integrated care, they can rely on their colleagues for help. It makes renal nursing very interesting.
I like how you mentioned that it can be an interesting job if you see it from a different perspective.
Correct.
And see opportunities within challenges. And that what makes, I think, nurses very resilient, even in times of crisis like COVID. What would you talk about in terms of the burnout that a lot of healthcare workers is facing? I'm sure during that pandemic, you have also suffered a little bit.
Yes.
So how would you suggest that maybe healthcare workers and even people outside of healthcare, you know, what kind of understanding can they extend to the frontline workers in hospitals and centers like yours?
I think the most important thing is self-care. I think a lot of the nurses, sometimes they give a lot, they don't know how to employ some of this self-care management. And so I think I'm very grateful to NKF because they've got a staff welfare club. And so they do a lot of activities to help nurses to de-stress and also the other corporate workers as well. And so I think self-care is a key thing, especially the last 2 years. A lot of them couldn't take leave to go home. Some of them are foreign nurses. They couldn't go home. So we started to encourage them to go cycling. They set up groups, you know, they go cycling, they go and play basketball and footballs and things like that. So building that community to support them is so important. The other thing is the public view of nurses. So there is a difference in Asia compared to Canada, where I worked. Nurses are very well looked up to in Canada. They respect nurses, very much. But in Singapore, sometimes nursing
It's
is
a
not...
thankless job.
Yes,
Let's put it bluntly.
It's a very thankless job. So I think it is very, I do see some of the public thanking the nurses, during the difficult time when they were being shunned in taking transportations and things like that. There are a lot of them who are appreciative. And so I think the appreciation, and I think our culture, we don't say thank you enough. We don't appreciate one another enough. And I think it will be good, for us to understand. So I think during this COVID period, I think the work of the nurses are very accentuated. People hear how we have been helping and going through that difficult time and the challenges.
And with the strain on the healthcare sector for the workforce, what makes NKF unique in terms of attracting and retaining talents?
Renal nursing is a very specialized
Profession
or a nursing aspect, and a lot of the nurses wants to have specialization. And I think one of the wonderful draw is that it is renal nurses are very sought after globally because there are very few of us. And so the Western countries especially are really taking up and employing a lot of our renal nurses, because it is a skill that you have to learn and acquire over the years. And so a general nurse will not be able to do dialysis. Not only that, I think renal nursing require you not just to be good with machines and with the treatment, but also the knowledge. Because it is not just putting on and taking off patient, but it's about improving their outcomes, understanding what are the complications that can arise with kidney failure, and what are the things that they need to do to be able to safeguard the patients from all these complications and from going in and out of the hospitals. So it requires a lot of knowledge and the integration of that knowledge into practice. So it is a continuous learning for the renal nurses.
Wow.
Not only that, you will come to a point where you will improve or increase your skill, especially in cannulation, in handling different types of machines, Medical innovation is always changing. And so it's very interesting. You are not stuck in the old traditional way of doing dialysis. Every few years, you get that innovation and update.
So what I'm hearing is that NKF actually provides and empowers the nurses to go on to this constant upgrading and improving of their knowledge and skill sets that make them so sought after outside of the organization.
Yes. So all of the new nurses that joins us are general nurses, registered nurses or ENs. We actually make them go through the fundamental course, which we call the Certificate of Renal Dialysis Management. So we'll teach them the fundamental of the technical aspect of it, and also the fundamental of understanding the complication of kidney failure and so on and so forth. So this course itself has been running in NKF for a long time, more than probably 20 years. And we have been improving the course program itself. It is 12 days over 6 weeks program, and with theory and then on-the-job training. And so by the time they reach 6 months, they are already good to go to be able to handle their load of patients. Then after about 2 years of practice, we bring them to the next level of to be in charge. So in a shift itself, we will groom them to be in charge of the whole load of patients, whether it ranges from 15 to 20 patients, and overseeing the nurses that is handling the assignment. And we will send them to Nanyang Poly. It's actually our program, but we have collaborated with Nanyang Poly to craft out this intermediate course, and it's accredited with Singapore Nursing Board, but it's only offered to NKF nurses.
If I'm not wrong, this is the course that was pushed under your leadership to get more students to be part of the healthcare sector in the renal care department.
Yes. So this is actually, we send about 26 of our nurses for this course, and it stretches over 9 months. It's a part-time course, but it will actually bring them to another level to be in charge of their unit, so that this is the career pathway and talent potentials that we are actually developing.
Got it.
Yeah. Eventually, we hope to actually offer this nationally in the future.
Nice. And as the Assistant Director of Nursing Services, what kind of goals do you have for NKF and for yourself?
I'm very passionate about
I can
renal
tell.
nursing.
Yes.
I'm very passionate to see my patient living their life to the fullest. And so I've been advocating for renal rehabilitation. So in NKF, we have the renal rehab model that we make sure the fundamental physical health of patients are improved through all the treatment. But then after they've been treated, we want them to improve in their physical functioning by encouraging them to exercise. And after they've improved that, those who are young, we want to encourage them to go to work. Because when you go back to work, it is important for your sense of worth and also your sense of self-esteem.
Ability to contribute and give back.
Exactly. And then living that life, because you're young, you shouldn't be adopting that sick role that, I've got, and waiting to die. But that the years that the treatment is giving you that improved health, you need to go back and do the best. I have a patient who has been on dialysis for 42 years. He's still a CEO of a company that he set up with his brother.
Wow.
So you can live your life to the fullest, and all of us will die, but at least you've done your best, in living that life. The other thing that I would like to push for this renal rehab is patient being educated and empowered about their own treatment and also involved in their own treatment. So we are embarking on self-care management, getting them to participate, checking their own blood pressure, and even priming their own machine if they have to, because that would actually help them to understand that, hey, you can be involved in your care. And I have a patient who actually, after I taught them this, he said, Pauline, do you know the last 5 years I've been waiting to die? But when I started empowering him and giving him back that locus of control, he said, I suddenly realized I can live my life to the fullest. I can live my life. So he started to renovate. He went back to work. He started renovating his basement, and he did dialysis at home. So you realize that when patients are participating in their own care, they actually feel that they can take charge.
Empowered.
Yes, they can take charge and they can actually live well, And self-care management is very, very important. But one of the most important thing is encouragement, part of this rehab. Not just from the nurses, but from families. So a lot of our patients actually come in being sick. They adopt that sick role.
Needy.
Yes.
You must take care of me.
Yes. But when they do that for 1 month, 2 months is fine. But it's over years, family is going to burn out. So it's so important that patient be independent.
Wow.
Once they get well, they must be independent so that they will reduce that burnout, their family burnout, their psychological, physical burnout. And then you find that because in order for patients to live their life to the fullest, family is always the reason to live. And so that cooperation, that collaboration is so important,
I have a personal question to ask you because I have a friend who is also a full-time caretaker for the mom's condition, and he mentioned that he's getting a little bit burned out from the caretaking. And you mentioned a very good point, that is to empower the patients to also take care of themselves and let them know that they have the autonomy and the power to derive health for themselves at the end of the day.
Yes.
Yeah. So for my friend, what kind of advice would you give to him to empower his mom to go through that whole the recovery rehabilitation process?
I have an 82-year-old mom, and she also adopted that sick role, and to a point that she was dying because she's got heart disease. I think about when she was 72, and everybody was like, encouraging that sick role from her, doing everything for her, and she was getting more and more demanding to a point that the family said, we are really burning out. And so I started educating my mom, and then I identified that because of that, she has lost a lot of physical functioning. All her muscle mass are gone because she refused to do anything. So I started encouraging her. I got her to exercise, a small step. And after she started exercising, she said, I feel better now. I started walking with her. Now my mom is 82. She's very independent, even though she's got heart disease. She's cooking for the family at 82. She's fit despite her illness. And I educate her on her medication. Because of one of the strokes, she was not able to she has some kind of a dementia, her memory loss. So we would put her pills for her in a pill box, but we will make sure she does it, and she takes it on her own, and we'll come and kind of double check. Initially, she was actually putting the medication in her pill box, but when she had that minor stroke, she was not able to remember. So what we did was we started to do it for her, and she was quite mad. She felt that, we took that control from her. So what we did later part was we tag all the different pills and paste it on the pill box to show her what are the type of pills that she needs to put in. So we are empowering her to take back that control. But we do double check to make sure that she takes her medication. If not, she'll go into another stroke.
So there's a fine balance in providing active care and also empowering and letting them be in charge of their own recovery.
Correct. Yes. So it's a mindset that family members need to change their mindset, not to over pamper their family members that are sick. Of course, in the initial acute stage, they can't help themselves. You have to help. But once they recover, you need to slowly help them to improve their activity of daily living and take back that little control.
Wow. Lastly, if you have a motto to describe your journey as a nurse, what would it be?
My motto is help a human being to be able to live their life to the fullest despite their illness, and that will give you the greatest satisfaction.
Tremendous joy as well.
Yes.
Right. Fantastic.
Yes.
Where can people find out more about the nursing industry and in particular being a nurse in NKF?
We have a website, www.nkfs.org/career, so you can have all the information you need there.
Cool. Okay, fantastic. And thank you so much for your time, Pauline. I really enjoyed my chat with you today, knowing so much about your personal journey as a nurse and also how we can empower patients to get up again despite their challenges in life and recover and rehabilitate and reintegrate to lead a very purposeful and strong, healthy life. So thank you so much for your time.
Most welcome. It's my pleasure.
If you have enjoyed our conversation with Pauline and want to learn more about the social impact space, please leave a comment, like and subscribe to our channel on all platforms that this podcast is on so that we can deliver new content to you. Epic Nation is a passion project created by the team at Epic Dialogue, a Singapore-based marketing agency that helps change-making businesses create social impact through our sustainability branding, communications, and digital marketing solutions.